Good afternoon, everybody. This is Tanya Williams in the Division of Child Care and Early Childhood Education. I am showing that it is 12 o'clock, so I'm going to get us kicked off. I know we have a guest speaker today, but I'm just going to give a few updates, and the staff will give some updates, and then we will let our speaker share some information with you all. We have 1,914 licensed programs that are open with the capacity to serve 165,608 children. With the current COVID relief funding, which is the CRSA funding that was passed in December, that we're currently serving essential worker families and paying supplemental amounts for voucher children, as well as some funding to each of the providers based on your licensing capacity and quality levels. We have utilized 55 million of the 119 million dollars that we have. So we're not quite halfway, but we're almost halfway there. Just from a licensing standpoint, please remember to report any positive cases, COVID cases. That is a communicable disease. And it is a requirement in licensing regs to report communicable diseases to the Arkansas Department of Health. So if you have questions about that, I think most folks have been doing that. But if you have questions, make sure you reach out to your licensing specialist. They can help you and make sure you get that information to the health department. As always, thank you all for everything that you're doing and everything that you've done since the beginning. It does start to feel somewhat more normal than it has, I think, over the past year and a half. Just a reminder, you know, we are in summer, and for those of us here in the division, I get really nervous during the summertime because of the heat with young children. We have seen things across the nation and unfortunately sometimes in our own state where children get left in a vehicle. So just be aware of the temperatures, both inside vehicles when you're transporting, if you're doing any transporting, but also outside. Again, if you have questions about that, check with our licensing staff. But, you know, we do get some really hot days and some very humid days. And for some children, it becomes very difficult to breathe. So just be aware and make sure you're doing those head counts to make sure we're accountable to all of those kiddos. But thank you all. I believe that one of our other units is going to be, or maybe I'm going to be reporting. I'll go ahead and keep talking. I think we had talked the last call in June about the supplemental payments, and we have those projected through probably the end of September, but right up to the 1st of October. And then we have 2 additional maintenance payments for providers that will be processed around August, and then 1 in November, and those will be the last payments for maintenance. We are still getting guidance from the Office of Child Care and working through the approval process for the American Rescue Plan Act funding that was passed in March. But essential workers will be extended. So just know that beyond the December timeline that we're currently keying, we do have funding to pay and key essential workers into next year, into 2022. So don't panic about that. I know some are still being keyed through December. So if yours haven't gotten keyed, the staff are really working hard to make that happen. We're doing all this without additional staff, but I can assure you all, we do have additional staff coming, and we will need them with all of this additional money that and additional cases that we'll probably be handling. So we will have new staff and starting to hire some of those as we speak. But that kind of gives you an update on the funding and information. So I will stop there, and I think the Family Support Unit has some updates.
This is Tom. As you can see, we are nearly finished keying all of our essential workers through 12/31. In ABC summer, we still have 10 facilities that we're working on getting keyed. I will say that if you have received an email from your family support specialist, please provide that additional information as soon as possible. We need that to be able to key all of those cases. Low income and extended support services cases, reevaluations are being completed as we speak. Claims, the next maintenance payments, as Tanya already mentioned, will be in August, and the supplemental payments for May are already completed. Supplemental payments for June will be keyed as soon as possible. And we are working on the American Rescue Plan, as Tanya has mentioned. We have what I feel is a pretty good proposal together to present to the legislators. It'd be a little premature to explain everything that's in that plan at this time, since legislators have to give our approval on that as well. But we will be notifying folks and doing a real outreach plan to inform everybody about that plan and the tremendous, and I say this, we have a tremendous opportunity to really change the landscape in Arkansas as far as child care is concerned. And we are very, very excited about what lies for us in that avenue.
Thanks, Tom. Well, I am delighted to introduce our very special friend and glad to have him back. Just a couple of comments from Tanya at the division. We are starting to see some breakthrough cases, people that have had the vaccine. So just be aware of that out there in the field. Of course, we know children cannot get vaccinated under the age of 12. And so that still poses a lot of risk for those of us. I'm not trying to scare you into getting a shot. I'm very respectful and mindful that people have a choice when it comes to getting a vaccine. It's no secret to my staff that I have a vaccine, but I still continue to wear a mask to keep myself safe. I have a 4-year-old living with me, and he goes to preschool, so he is at risk and gets exposed himself. And so I just choose to do that, and that is my choice. Just encourage you guys to pay attention to what's going on. I really wanted Dr. Tumilson to give an update and share, what's happening currently out there on the COVID horizon and what we're seeing. And if you have questions, please, he's just an incredible resource and expert. So just thank you so much, Dr. Tumilson. We're so glad to have you back.
Yeah, thanks, Tanya. I guess what I've been asked about and what is happening with COVID now and in the immediate future, near future, is the Delta variant. And so why do we care? So just for perspective, right, this hasn't been the first variant. Viruses mutate. There have been lots of variants. The vast majority of those variants you never even learn about or hear about. Nobody ever knows about because they didn't give the virus any kind of advantage. So they just, kind of go along and die off, or they're, trucking along like the ancestral virus, the original variant, right? But some of them, the ones we are concerned about, are ones that can either cause more infection, mean they transmit more efficiently, or they cause you to get significantly sicker than the original virus did, or maybe the monoclonal antibody treatments, like we give infusions to people when they do get sick with COVID, maybe they don't work as well against this variant, or maybe the vaccines that we've got don't protect as well against the variant. And so with the Delta variant, what do we have? The main thing to know about the Delta variant is that it spreads much more easily. The estimates are that it spreads 2 to 3 times more efficiently, easier than the original strain that we were dealing with here in the U.S. last fall, or last summer. So what we were dealing with this year is becoming different. Now, you may remember that's the Delta. Let me talk about the terminology because it's changed. Because no country in the world or place wants to have a nasty virus variant named after them, understandably, we've stopped, thankfully, calling them by names like Brazil or South Africa, or this one was first discovered in India. And then the other naming system has all those numbers, and this one's B1.617.2, but who can remember that except, people like me who are stuck in it all day long thinking about it. So this one now called Delta, they've just started naming them with letters of the Greek alphabet. And so the one we're talking about is Delta. And remember, we had the Alpha virus, which was the UK variant, right, before, and that actually has been since probably late winter, the most common strain ice that we've sequenced of all the different variants. That's the one that is most commonly found. It is the predominant strain right now, but that is changing. Well, he lucked out kind of with the Alpha variant because its spread was faster than the original virus, but it was only like 50% faster. So things were getting better. We were vaccinating people. The good news with the Alpha variant is that you seem to have just as much protection from it with your vaccines as you did with the ancestral strain that all the studies were done on, right? So what's the case with Delta? The main thing is that it spreads faster, 2 to 3 times more easily. What do I mean by that? So in the daycare world, for instance, in the last month or so, we don't always have confirmation yet that these are due to Delta variants, but I'm very suspicious because whereas previously we were getting little clusters and outbreaks in daycares that, not just daycares, but in churches, et cetera, that might have 5, 6, 8 people for a big one. Now we're seeing where those tend to have 10, 15, 19 cases. We even had one where there were 29 connected cases to a daycare. So more people are getting infected at a time, right? And so that's what I would say. This has, it's a little hard to tease out because, the honest truth is we've all kind of let our guard down a little bit to some extent. And that's been good and pleasant. But what I would say now is go back to those same measures, as many measures as you can still implement in your daycare as possible, is what I would say. Keep those cohorts intact. I know some of it seemed like, in the summer, some places are more in a day camp kind of mode. So there was more mixing and things like that. Cohorts still work pretty well. That for daycares, we haven't been able to keep little bitty kids separated from each other like some other places were able to do. So, but just as much of that as you can do. Our littlest ones can't wear masks, but I would say for the ones that are old enough to wear masks, have them wear their masks. Keep doing that. A lot of what I've noticed is that once the CDC put out guidance for fully vaccinated people, right, which is 2 weeks after your last dose of vaccine, once they put that guidance out for fully vaccinated people, everybody applied it to themselves, regardless of whether they were fully vaccinated or not. Not everybody, right? That's not true. But a lot of people just took that, oh, okay, then they're not masking. That means I don't need to either. If you're not fully vaccinated, you don't have protection, you need to mask. And remember, our little ones under age 12, they're unprotected because they don't have the ability to they don't have the availability of the vaccine for them. So if they can wear masks, then do it. For instance, my son is 9, went to a day camp today, and I said, take your mask with you, wear it when you're inside. And that fits with CDC guidance. So keep doing as many of those things as you can. Now, with the Delta variant and the vaccine, what are we seeing? There is the information that we have so far is mostly out of England. Why England? Because the Delta variant took hold there faster than it did, or sooner than it did here. And they also have a very good vaccination program. So they were able to compare data on people getting AstraZeneca vaccine, which we don't have, but also the Pfizer vaccine, which we do have. And what did it show for the Pfizer vaccine? So extrapolate that to Moderna too, if you got Moderna. There was some decreased effectiveness of the vaccine, meaning the protection it offered to keep you from getting any symptoms of COVID dropped from about 94% to 89%, and they're still working on data. It may be slightly lower than that. So in the broad scheme of things, that's still really good protection, all right? That means you've got a 88%, 89% better chance than somebody who doesn't have any vaccine of not getting infected and not getting sick at all. The better news is that despite that drop in effectiveness at keeping people from getting sick at all with COVID, with the Delta variant, the hospitalization protection remained. It remained above 96%, right? And death even better than that. So, and remember, that's what we always got to come back to with our vaccines. The main reason to get vaccinated is so you don't get really sick and you don't die. And it remains that the vaccines that we have seem to be very good at that. Even even if with a specific variant like the Delta, like maybe some other variant that comes along in the future, the effectiveness of the vaccine at keeping you from getting sick at all drops a bit. This is analogous to flu vaccines that many of us get every year. You know, how many people have you talked to as a doctor? Oh, I'm not going to get that vaccine. It can't even guarantee I'm not going to get sick. Well, you're right. Some years the flu vaccine is only about 50% protected. On a bad year, 40. On a good year, 65 or something percent from getting infected or symptomatic at all from the flu. But every year it is really, really good at keeping people out of the hospital and dying from the flu. And that's important. That is the biggest reason we vaccinate people from the flu. And then, you know, we know we can decrease by at least a half people who get sick from the flu. Those are, and compare that, that's 50%. The vaccines we have are even much better than that for the Delta variant. But as Tanya alluded to, we have seen more breakthrough cases. And as we get variants that are able to infect us more easily, even if we're fully vaccinated, we will see more breakthrough cases. We were seeing breakthrough cases even last, even in February, right? It happens because no vaccine's perfect. You would not get any breakthrough cases, right? When you're vaccinating millions, hundreds of millions of people across the country, and, you know, we're over a million people, well over a million people here in Arkansas. When you're vaccinating that many people, you're going to get vaccine breakthrough cases unless your vaccine is 100% effective, and there ain't no vaccine that's 100% effective. So that is what I would say by way of talking about the Delta variant. And so the main point, it is more infectious, it spreads more easily, and the vaccines aren't quite as good, although they're still very good. And the vaccines will still keep you from going to the hospital or dying. And so that's really the biggest thing, and why I'm still, you know, encouraging vaccination. Even if it weren't for that, if it was just even with the reduced effectiveness down into the upper 80s or wherever it turns out to be, well, that's still better than 0% infected. 0% protection. And remember, we're learning a lot about COVID. Thing that's been talked about a lot lately, and that I've been seeing more and thinking about, is post-COVID symptoms or syndromes, long COVID, so to speak. You know, that's stuff we didn't know last spring. We're just starting to, it's just starting to clarify. And how many people, like what percentage of people who get COVID are going to get long COVID, it's up in the air. But I'm sure you've talked to people who have those symptoms. We have, you know, people here that I work with who've had significant problems with long COVID symptoms that can last for quite a while. So yet another reason in my mind to get vaccinated. So that's what I would say. Otherwise, about the Delta variant, where are we at right now in Arkansas? The estimate is that probably 30% of our variant cases are due to that, and the predictions are that it will be the predominant strain in Arkansas by August, and certainly by the time school starts. So that's not good news. And so, you know, I think, like Tanya said, she's still wearing her mask. When I've begun going out in public, I'm wearing my mask more often than before. When I'm here at work, I'm putting it back on when I'm interacting with other people, just because we don't want to wipe out our hallway of workers. We don't want people to get sick. And I think, you know, the thing we've got to realize is it's not that difficult to put it back on. Let's just do it when we're in public settings, right? No, I'm not talking about when you're by yourself, like I'm here in my room. There's no need to do that, I don't think. But when you're having meetings, if you can have meetings remotely, I know y'all are spread out quite a bit, so y'all do that anyway. Well, I don't think there's a reason to stop having those things. If the meeting really needs to be in person, okay, well, let's space ourselves out and put our masks on while we're in the meeting. And you can apply those same kind of thinking to your daycares if by chance you have backed off on a few things. CDC is still saying that they're not recommending fully vaccinated people have to start wearing masks again. I'm just telling you the situations in which I'm kind of doing that myself. And then, you know, for the people that you're taking care of in your child care center, you know, most of them are of an age that they can't possibly have been vaccinated yet. So, you know, increased masking would be a good thing in those settings. And I guess there's some questions.
There's a couple of questions. Yes, Dr. Tumilson, if you could take, there was one about the common symptoms that children are presenting with.
Yeah, so I don't have specific new information about the common symptoms that children are presenting with Delta, but there is some indications out there that, and we've heard this, seems like with Delta, more people are starting, the symptoms they start with are just a runny nose and congestion instead of the full-on fever. A lower percentage of people are having significant cough than with, you know, the ancestral strain. So that's harder, right? If a lot of people, their chief symptom, or at least initially, is runny nose and congestion, that's what means a lot more people are showing up at work having thought it wasn't a big deal, all right? Because it's just a runny nose, and we've dealt with that before. But I think those are the key points about symptoms. And I think I haven't seen anything to say that that's not the case with children with this, but I don't have specific differentiation on adults with Delta symptoms and kids with Delta symptoms. So that is what I would say. You know, so it was runny nose, congestion, sore throat, and headache were more predominant with Delta than they had been. Not remember, those were symptoms with the original one, right? Plenty of people had those symptoms, but it seems a little more common with Delta than what we were seeing before.
Any other questions? I know Kelly has posted in the chat box the information about the current guidance for you all. Someone had asked for an update on that. If you need assistance, if somebody really specifically has questions, please let us know. She's also put the COVID hotline at the Department of Health in, which is very helpful. And then there's a question, Dr. Tumilson, from Amy Ramey about the COVID test, if you could answer that.
Yeah, the initial test you get back, Amy, will not tell you whether it's COVID, Delta or not. It'll just, you know, first of all, the antigens will never tell us that. They just don't have that capability. PCR will not tell you either unless it's sent probably to a different lab, or sometime of the big commercial labs, if that's where yours went, can do some genomic testing for Delta. But the problem is that it takes so long to get that confirmation of whether it's Delta or some other variant back that it's days or weeks down the line. So, you know, up until recently, the turnaround time has been like 2 or 3 weeks when we send off a sample that we already know is positive for COVID, a PCR sample that we already know is positive, send it to the folks that are working with CDC. We're getting some cooperation. Eventually, we're going to have that capacity here in our public health laboratory at the Department of Health. So the turnaround time should be better, more like 7 days or so, sometimes sooner. We have a collaboration with another reference laboratory that at least initial results, so they're getting them turned around in about a week as well. So there's hope, but still, right? I mean, by the time you're a week in after your positive test, well, you're almost at the end of your isolation. It's always going to be slower. There are some other tests that laboratories can do with a PCR, but they don't usually do that initially. You get a positive test and then you send that test for extra testing to find out. So sorry, that was a long answer. The days normally sick with the Delta variant, we don't have any indication it's different as far as length. We haven't changed the isolation time. So it's still 10 days from when you started symptoms. And I think you could anticipate that being similar with Delta. But so far with the variants, there hadn't been any indication that any of the variants really cause you to be sicker longer necessarily. It's really more of your individual risk of getting severe disease, not so much necessarily the variant. And I would anticipate that would stay the same with Delta.
So this could be a Dr. Tumilson question, and a Kelly. This is really about classroom setups for the fall. So Kelly, if you want to take a look, and Dr. Tumilson, please feel free to chime in.
I don't see
I'm not
that.
seeing that one either, Tanya. That might have been a direct one to you.
Oh, you know what? It is. I just noticed that. Hang on. I will, if you don't mind, I'm not going to put your name in, but I'm going to copy it and type it in the chat box for everybody to see.
It's okay. I'm sorry. I can copy it in the chat box. I'm sorry.
Okay, that's okay. No problem. I just want to make sure that because if you're asking, there could be others. So it's very helpful if we just let people know. So thank you so much. It's a great question.
While you're doing that, Tanya, I would also say, just in response, a little bit more detail about the question earlier regarding procedures. So we still say we recommend 14-day quarantine for those close contacts. You can do 10 days if there are no symptoms, and this is for people who are unvaccinated. Vaccinated people still do not have to quarantine if they don't have any symptoms. You can do 7 days if they're tested on the 5th, 6th, or 7th day and test negative. But otherwise, it's the 10 days with no symptoms or 14 days, which is still a recommendation. Always call the call center, like Tanya said. If you have a positive case, we can help talk you through any questions about quarantine or returning to work, things like that.
Yeah, and I'll just comment about that. I know just from hearing some of the things about some of the calls that come into the call center, you know, like questions about, oh, do I have to report all the contacts? You know, because it's, you know, you have to put them all on that list and find all their contact information. Yeah, it's still important. Remember, quarantine and isolation aren't going anywhere, right? It's a little easier now because if you're fully vaccinated, you don't have to quarantine unless you have symptoms, then you need to isolate. But for everybody else, we still have to do quarantine and isolation. Because remember, the reason we do quarantine is that about 50% of spread is from somebody that's got no symptoms. And so that's why we need to quarantine people who are at higher risk of developing the illness. There's another question that says, do you recommend a quarantine for families returning from traveling? No, that's not from travel within the United States. That's not a recommendation of ours. Arkansas doesn't have any requirements to quarantine from anywhere, really. The CDC, I believe, still has a recommendation on international travel for those who aren't vaccinated, fully vaccinated, to self-quarantine for like a week when they get back. If you wanted to apply that in your own business and setting, I would not fuss at you because it is safer. But, you know, there's a lot of people going on vacation this summer. And I mean, you know, the question you kind of have to ask with those travel things is, are they more at risk of getting it when they go to Florida than just hanging out here in Arkansas, unless they're being careful here at home? And the answer right now is no. So that's why we don't really recommend it. There's a question, Maricella's question says, we are setting up our classrooms for fall. Is it okay if we sit 4 children per table facing each other? We just wanted to be sure we are following protocol. So, you know, the only thing I can really say is I don't know what the age of these kids are. If they're school age, what CDC has said about elementary school is that they need to be at least 3 feet apart. In general, I would say not facing each other is better. But that's, you know, basically, I know with childcare, we've kind of been, yeah, I see your chairs there. I would say not facing each other is better because then they're not blowing their breath right at one another's face. You know, the kid sitting across from them is not getting direct respirations. He's getting it diffused a little more. Hopefully that's helpful. So if you're looking for what's best, I would say not sitting together. Technically, CDC would say as long as they're 3 feet, at least 3 feet apart. What I'll tell you about that is that I recommend you space them out as much as you can, just like last school year. So that's what I would say, because 6 feet is safer than 3, okay? The 3 is kind of an allowance, and realize, you know, all this is coming from schools. There were places around the country that were not admitting a kid into a classroom because the class was at its limit that it could maintain 6 feet. And what they don't want is kids missing out on their schooling for reasons like that. And I would say that, yeah, it's not a reason that you should keep a kid out of school or out of your class, but just space them out as much as you can reasonably, at least 3 feet for those older kids.
Thank you, Dr. Tumilson. That was a great question. Thank you for asking that question. You know, I know this is hard, gang. The reason I really wanted Dr. Tumilson back today is, you know, there's the health aspect of it, and I'm very much on the public health side of this, but there's also the economic side of it. And, you know, I just wanted to point out to you guys, you know, if we don't continue to try to keep everybody safe, as we're seeing, you know, some increase, then your business may be impacted by that. So it's just as much about the economy of it for you all in the early childhood business as it is about the public health of it. So I'm here to make sure that we're taking care of children safely, but I also want to make sure that your business is sound and that you're able to continue to operate. So it was just as much about making sure that you don't create an environment that you have a lot of outbreak and you have to close down or close classrooms, which can impact your bottom line, as we all know. So I just really appreciate you, Dr. Tumilson. I don't see any more questions. So we will definitely be having you back, sir. And we just appreciate all the time that you've given us and your expertise. So just know he'll be back. We'll invite him. If you guys have any more questions, please feel free. I know it's a little bit lighter call today in terms of participants. I'm sure with summer, people are out and we just had a holiday weekend. So I don't want to cut us short, but if anybody has any additional questions or any other updates from my team, feel free to speak up now. And I do see a question from Jennifer. Yes, that is correct, Jennifer. We have reduced our requirements to guidelines. And I'm just highly suggesting that you follow. And I think Dr. Tumilson has said it as well as he can too. We just recommend that you continue to follow the best safety practices that you can to keep yourselves and the children and families that you serve safe so that you don't have big outbreaks in your community that have an impact. So, but they are guidelines. Kelly posted those in the chat box. They're on our website under important COVID information. So just pay attention to that. The prediction of how much longer essential worker vouchers, yes, we have funding and a lot of funding has come into the state for essential workers. So they are keyed through December on the current funding that we have, but we will have funding potentially up through 2024. So just as a reminder about essential workers, and while Dr. Tumilson is on, this is for people who work in essential types of work. And that includes the healthcare profession. It includes doctors and nurses and therapists. It includes early childhood care professionals, teachers, paraprofessionals, directors. It includes sanitation workers, food supply chain, from McDonald's to the farmer. It does not matter the income. There is one income question, and it's if you make over $1 million, that's a federal requirement. And we've only had a couple of those that were disclosed that we could not serve families. But if you know anyone or have any folks that need childcare assistance, this is the time to take advantage. And we do have funding potentially up through 2024 to continue to serve those families. It's $178 million that's going to be in that category. I believe we're going to be using about 130 to 140 million for essential workers. So just guys, we have a lot of funding for that. That's not going to end after December. It will go into 22, 23. You know, part of it depends on how many families we add. If we added millions, it might not go as far. We might not be able to go through 24, but you know, right now we are serving close to 10,000, I think, families. And we're continuing to add daily, but we do have adequate funding and we'll continue to serve them as long as this funding is available. So I see a couple of things in the chat box. I'm going to try to go back through.
Tanya, that asked about serology tests. So serology tests, a titer test. So a titer test is a serology test. It's an antibody test. It's a measure of the level of antibodies in your blood, in this case to COVID. There are antibody tests available. You can talk to your doctor about getting one of those if your doctor thinks you ought to check it. The thing I would emphasize with those is a lot depends on the particulars of that test, and your doctor can help you tease that out. One, if you think you're currently infected or you're worried about that because you've been exposed or because you got symptoms, you don't need a titer test. You don't need an antibody test. You need one of the nasal or mouth tests, right? You need a PCR or you need an antigen test. Those are viral tests, and you need one of those. They detect the virus, either a protein from the virus or the RNA from the virus. The antibody tests are more kind of after the fact. And so a lot of people have asked because they want to know if their vaccine did them any good, did they have any antibodies? And so basically the vaccine makes antibodies to the infamous spike protein, right? And so if you get a titer test, an antibody test that can distinguish between antibodies to the spike protein or antibodies to another part of the COVID virus, that usually it's the nucleocapsid protein. You should only have antibodies to the nucleocapsid protein if you had an infection at some point in the past. But if you just get one that doesn't specify and it says positive, we don't know if that's an antibody to the spike protein or to what. So that's the warnings I would say with that. But yes, they are available. And then there was a question about if a child is a close contact, they still have to quarantine for 14 or 10 days, like Kelly mentioned, or the 7 with a test on day 6 or 7. But we do not have to close since we are vaccinated. Correct. I mean, you know, it's been rare throughout this whole thing that the health department's actually told a daycare they needed to close just when it was really clear. And to y'all's credit, y'all made that decision earlier, and it was, you know, the right decision because you saw it the building. And, you know, if you get a certain number of people have to be quarantined, you don't have anybody can work there. You know, y'all were making those kind of decisions, right? But it's still really up to you. Sometimes we might recommend it if it's, you know, like, wow, this is, you know, it seemed like a small deal, got to be a much bigger deal. Maybe we do need to shut it down for a few days, but we do that very rarely, that we make that recommendation. Yeah, and I hope your parents still notify us though. So that's maybe a good point about communication with parents, especially if maybe they're coming back to daycare, you know, after the summer or whatever it is, that the need to not send your kids to school sick is important. If you do find out about your kid being positive, we need to know about it as soon as you can. If your kid's exposed and they have to go home and then later you go and get them tested, then let us know, those kind of things, so that y'all can be on top of it.
So Tom, I see a question. It's regarding, I think, the essential workers, and it probably is the teaching staff that is off for the summer. Can you take that one?
Yes, as long as they are on contract still with the schools during the summer, we accept that contract as still being employed and they still qualify.
And then Jennifer Easley had a question. I think, Jennifer, are you asking for essential workers? It looks like you have new families, and are you ready? And would we be willing to take those? Absolutely. There's really no good or bad time. I don't know if they're needing it starting August or if you're, you know, needing it before then, but yes, please just go ahead and have those families submit, unless Tom has a different direction there.
No, we're good for them to submit. Like I said, the thing we're looking at is are they already on contract?
Good deal. See, Tom, reading that next question, Lynn, that might be a little more complicated. We're working with the regional office regarding some of this. There have been some changes on how we can handle payments. In general, programs can charge families a higher rate if they're quality. That's currently what we have in place. But there are some new things, and they were part of our state plan. So we may need to get a little more information, unless, Tom, you feel like you have a solid answer on that one at this point.
At this point, they can charge the difference between what the voucher pays and their rate for essential workers. The new plan, I don't think, kicks in until October 1st, when that difference then will be eliminated to the 15%. I guess that's the question they're really asking. However, if they give discounts for a number of children, those discounts need to also be given to essential workers as far as their payments are concerned as well.
Yeah, let me just point out, I didn't see the distinction there, and I thank you, Tom, for pointing that out. If you're talking about essential worker vouchers, families who typically would pay, there is a difference there than our regular low-income families, gang. So, I'm not aware that there's any issue, but as Tom said, come October, there may be some changes. So there's nothing today that would prevent you from doing that. So if you have parents who typically pay, who are above the normal low-income voucher requirements, then you can charge, a fee for that. I don't see any reason that you can't. We will keep you updated as our state plan goes through the federal approval process. And if that's going to have an impact, if that cap or 15% cap has an impact, it may only affect low income or other rates, but it could have an impact on essentials. So just stay tuned. We will keep you updated on that. And so the next one, Tom, is about, can we bill our teachers that are out for the summer, and how do we file it? They are on contract but need their spot saved.
So there is still the absentee requirement that would kick in. So there's so many absentee days that you can charge once you in the absentee days, then either the client would have to pay, or if they wanted to save a spot, we couldn't pay past the absentee days.
Thank you. And then Amy, great question. Have the new rates come out? That is actually in the state plan. We have submitted it to the feds. We probably will have some back and forth between now and September for approval, but if and when it's approved, it will go into effect October 1. The rates can go into effect like September 30th. They can go into effect right before the plan is approved, but not that much earlier. So just be aware of that. It definitely will not be before September 15th. So just be watching for those new rates, but those new rates are out on the website. And I do encourage you all to take a look at those. That was part of the state plan submission. And, we're excited about that. If you haven't had a chance to look at them, I hope you'll be excited about what we've done. We've also looked at some geographical areas and made some adjustments. And I think it really is a good start to paying what should be paid for the voucher payment. So anyway, take a look at that. We're still working through the federal approval. They're not a done deal yet, but if and when it gets approved, those would go into effect at the end of September, and the plan would be approved starting October 1.
Anya,
and that is
questions for me. I'm gonna ask off the call if that's all right.
Absolutely. Thank you so much, Dr. Tumilson.
Hi, y'all.
Okay, Lynn, I see one. Oh, the link. Hey, Rachel, if you could put the link to the state plan, it looks like some folks are asking for that, and we can definitely do that. And Lynn, yes, it will include essential. All of the rates, when they go into effect, will affect all of the voucher families, whether they're essential or a regular low income. So be aware of that. The new rates will be across the board. Oh, and thank you, Amy. I know change is hard. We struggle with it here, and the new site, while a lot of people are excited about it, we struggle here to navigate. But if we can help with anything, let us know. And if you all have ideas, we can certainly feed it to our communications staff that handle that. We're, like you, sometimes subject to all these changes and have to learn how to navigate it as well. I think the thought was that it was a much simpler plan, but I know I get on it and look for things, and I probably feel a lot like some of you. I can't find it. I was used to it somewhere else. So thanks, Rachel, for popping that state plan in. And she said that the PowerPoint is about halfway down on the page. So just be aware of that when you're looking at it. That may help you. Okay, gang, it's 12:44. I don't see anything else right now. Our next call, I know it was on the PowerPoint, I believe August 3rd. Is that right? Somebody give me I don't have my PowerPoint pulled up anymore. But I believe it was August 3rd. So it will be the first Tuesday in August at 12 o'clock. And there it is. I was correct. It is August 3rd. So we look forward to hearing from you and seeing you. If you have any questions or if you need any of us before then, just please reach out to us by email, check with your licensing staff if you are trying to get in touch with someone on that side. We look forward to continuing to serve you, and just thank you all for everything you're doing. I hope you have a great rest of the summer. We'll be closing in on the start of a new school year by the time we talk next. So just continue doing safe things, and wish you well.